This is CBC Here and Now.
Tonight, the latest on COVID-19.
People in St. Anthony are worried after a healthcare worker tests positive.
And confirmation that a paramedic in St. John's has COVID.
I know that the health system is saying even with that you should be getting testing, but I know a lot that haven't because there's just a lot of barriers to doing it.
Well, it may not be so easy to get a COVID test if you're living in rural parts of the province.
One woman tells us about her 5-hour round trip to get her sick kid tested, and why she's calling for mobile testing centers.
Large area of low pressure brought lots of snow to parts of the island. It's going to continue for most of Labrador, then another round on the way for tomorrow.
Good evening and welcome to Here and Now. I'm Peter Cowan.
And I'm Carolyn Stokes.
We start tonight with details of 2 cases of COVID-19 within the healthcare system.
Yes, one case was confirmed in St. John's and another case in St. Anthony that's causing some worry for residents.
The Paramedics Association of Newfoundland and Labrador is confirming one of its members has contracted the virus that causes COVID-19. The association says it's the first time a paramedic in this province has tested positive. Here Now's Mark Quinn reports.
They're on the front line, but over the past year, none of the association's 900 paramedics have tested positive until now.
I have confirmed that there is a paramedic in our province that has contracted COVID-19. They are currently doing well and are self-isolating at the moment.
CBC has learned that the paramedic who tested positive works in the St. John's area. They respond to calls and bring patients to hospitals and healthcare facilities throughout the region. Goody says a number of paramedics on the Northeast Avalon are now in isolation because of possible exposures.
At least a handful or more here in the St. John's region that are isolated because of ongoing situation with St. Clair's and different exposure incidences.
Goody says paramedics were already under-resourced and overworked before the pandemic, responding to about 10 calls per 12-hour shift. But now, infection control makes their jobs even more difficult.
Wearing a full PPE on basically every single call. So that requires a face mask, like an N95 face mask, face shield, gloves, and then a tie-back or a yellow gown, depending on the situation. So this all needs to be put on prior to entering the household.
Once they get to hospital, medics have to stay with their patient until an emergency bed is available. That's because patients can no longer be left in a bed in a hallway in case they have COVID.
So now they're confined to the back of the ambulance with that potentially positive patient and basically stuck there until a bed becomes available. So we've had people waiting in there for hours in the back of the ambulance waiting for a bed to come available while wearing this equipment.
Goody says the source of the paramedics' infection is still under investigation. Mark Quinn, CBC News, St. John's.
Well, late this afternoon, Eastern Health said 90 of the 1,500 people tested in connection with the St. Clair's outbreak were paramedics. It won't reveal where people who tested positive worked, citing privacy reasons. Eastern Health says 97% of those test results are back, and there is now one additional positive case for a total of 13.
Now to St. Anthony, where the mayor says people are nervous about the positive COVID-19 case at their local hospital. Here Now's Colleen Connors has more on what's happening.
A healthcare worker who works at this hospital tested positive for COVID-19, but there doesn't appear to be any threat to any patients at this time. The person is someone in their 20s or 30s. All their contacts are aware and are in quarantine, awaiting a COVID test. Labrador Grenfell Health says no patients at the hospital have been deemed close contacts. Today, the mayor says some people are nervous to go anywhere near the Curtis Memorial Regional Hospital. No one with the health authority was available to speak to the media, but did say in a release that some services may change at the hospital because of this case. It's not clear if the positive case was travel-related or connected to the Metro outbreak. We do know that Labrador Grenfell Health set up a testing site from 9 to 3 with no appointment necessary, similar to drive-through testing sites in other parts of the province. Because of stormy weather in the area, the drive-through testing site will continue all day Wednesday. Those living in nearby communities can make an appointment online. Right now, there are 2 active cases in the region. Eric Boyd says people in the community are nervous about this most recent case. He wants residents to take the health guidelines seriously.
You can't become complacent. That's one thing that you can get in trouble. And I think, things fall off the boat. What happened in St. John's can very easily come apart. So people got to respect other people. Expect their distance between other people. You got a piece of property there, and you respect them. That's what you have to do. Wear your mask and listen to what Dr. Fitzgerald and her team are saying.
Boyd says the town's main office and arena are closed to the public. He doesn't want his community to go back to alert level 5. Colleen Connors, CBC News, Corner Brook.
Well, what is the latest on COVID in this province? There are 5 new cases to tell you about tonight. There was no medical briefing this afternoon, but we got an update on today's numbers, so let's take a look. Of those 5 new cases, 4 are in the eastern region. The 5th is that healthcare worker at the hospital in St. Anthony. With 36 recoveries since yesterday, that brings the total active cases in the province right now to 203. There are 9 people in hospital right now. 5 of those are patients in the intensive care unit. And as a reminder, anyone 70 or older can go online to pre-register for the COVID vaccine. That can be done online or over the phone.
Well, March has certainly come in like a lion. A messy start for the day as another winter storm hit. The second this week. Metrobus took buses off the roads this morning in the St. John's region. Some highways were also closed, and police asked drivers to stay off the roads. And on the West Coast, police saw cases of stranded drivers.
Yeah, it certainly wasn't a nice start to the day. We ended up with about 11 centimeters at the St. John's Airport, anywhere from 13 to 15 centimeters, depending on where you were around the metro area, and then Gander and Deer Lake between 10 to 15 centimeters of snow fell today. We saw temperatures slowly climb up above 0 for most areas as well, and then those temperatures mild for Labrador. Cartwright sitting at 0 degrees earlier this afternoon and -7 for Lab City. And the other thing to note was how windy it was earlier today. Topped out at 150 kilometers per hour for Wreckhouse, Stephenville 102, and then as you head a little bit further east and pretty much across the island, we saw winds gusting anywhere from 60 to 90 kilometers per hour earlier today. Now that's all thanks to an area of low pressure that has moved through. This cold front is going to drop those temperatures as we head through the overnight tonight. And you can see an area of snow is developing for the southern portion of the Avalon. And then some cooler air will move back in. I'll have all those details coming up.
Thanks, Ashley. Well, there was a rescue last night aboard a fishing vessel off the northern peninsula. This video is from the Joint Rescue Coordination Center taken northeast of St. Anthony last night. A crew member on board a fishing vessel needed a medevac to hospital. That person was hoisted from the fishing boat and brought aboard the Cormorant helicopter. Search and rescue officials say lights were provided by a C-130 Hercules plane based out of Greenwood, Nova Scotia. The patient was taken to hospital in St. Anthony and is in stable condition. Well, the provincial government says a group of 30 hunters from Quebec are killing endangered caribou in southern Labrador. It's almost an annual occurrence. Hunters travel to Labrador to kill the animals. Charges are rarely laid and convictions are even more rare. The province estimates there are only about 1,700 Mealy Mountain caribou left. They're considered endangered and there's a ban on hunting the animals. The Labrador Hunting and Fishing Association is worried about the impact of this most recent hunt.
When they're hunted, dead, they're gone. There's no other caribou walking into that territory, so it's very disappointing. It's the closest bunch of caribou to the Labrador southeast coast, and they're very vulnerable. They can't sustain any type of hunting activity whatsoever.
So what is the solution? Hollis Yetman does have some ideas on that front. We'll hear about them a little later in the show.
As people over 70 register for their doses, a man with a rare and chronic lung condition is questioning why he isn't a priority for the COVID-19 vaccine. Here Now's Heather Gillis has his story.
Dylan Murphy says he has primary ciliary dyskinesia, or PCD for short. He says the rare and chronic lung disease is like the little brother of cystic fibrosis. It means he only has about 75% of his lung capacity. When the first wave of COVID-19 started last year, Murphy got worried and moved from St. John's back to his hometown on the Burin Peninsula.
we would be more susceptible to dying from it.
On Friday, the province unveiled its COVID-19 immunization plan. Phase 2, set to start in April, prioritizes vulnerable groups, like those 16 to 59 who are, quote, extremely clinically vulnerable. People with cystic fibrosis and severe respiratory conditions are eligible. Murphy considers himself extremely vulnerable, but because he hasn't been hospitalized for his condition in the last year, he says he doesn't think he makes the cut.
The people with CF are being prioritised. Why shouldn't people with PCD also be prioritised in the same way?
Meanwhile, on the front lines, some doctors in high-risk environments have already been vaccinated. Workers who have direct contact with the public are included in the second phase, but the president of the Medical Association wants to see them pushed to the top of the list.
I know for the community-based physicians in St. John's, that's not been the case. Many of them have yet to be vaccinated, and like I said, we would certainly like to see them made a priority, as they do see a lot of high-risk, vulnerable patients.
She says doctors are ready to step up and help with the vaccine rollout and will soon talk with the health department about what that will look like.
Eastern Health Paramedics was the exact location of your emergency.
Nearly all paramedics in the St. John's area are vaccinated, although not across the province yet.
There is a high number of people, paramedic practitioners, that have been vaccinated, but not everybody has received it, of those that want to receive it.
Phase 2 of the province's vaccination plan begins in April and runs until the end of June. Heather Gillis, CBC News, St. John's.
Well, a weekend testing saga has one mother in rural Newfoundland scratching her head. Ashley Bevins lives in Seal Cove near Bay Verte in central Newfoundland. When her kids got sick, she went to get them tested for COVID-19. The only problem? That meant a 5-hour round trip in the snow with nowhere to stop. Here's her story.
Well, they said that the testing facilities were either Gander or Grand Falls. And since Grand Falls is an hour closer, then that was the option we went with. Because I wasn't sure what was going to happen weather-wise, we had all of our snow gear packed in the trunk, and we weren't sure if we could stop anywhere to get drive-through. So it was snacks and drinks and extra change of clothes because they're vomiting and everything else. So it was, it's not easy getting out the door anyway. And once I started talking to my husband a bit about the logistics of it, it's kind of like, okay, well, I don't know if we can go to the bathroom. I don't know if we can get something to eat. I don't know anything like that. So but maybe had I asked, I could have got more of an answer, but nothing was really offered to me either. So my daughter her stomach was very sick on the way there. So I gave her some medication for that, and it seemed to kind of keep it at bay. But I mean, the whole time you're just kind of waiting for a cue to come from the back seat with that like awful sound where you gotta pull over now. Fortunately, my kids were okay with pulling off on the side and finding a quiet road. But I started to think, I'm like, what if I was like a 70-year-old, 60-year-old elderly woman? I mean, I can't imagine them pulling over the side of the road and going to the washroom, but we did it because we had to. It wasn't easy. It wasn't conducive to people who are feeling sick. Like, I don't know if we have COVID, we could just have a flu, but even when you have a bad flu and your head is aching and you feel like garbage and your stomach isn't feeling good, the last thing you want to do is go for a 5-hour round trip somewhere and not be able to get out of your vehicle. So it wasn't the best day. By the time I got home, I was absolutely exhausted. The kids were exhausted. And I mean, we're a young, relatively healthy family. So thinking of someone else older than me or with more health problems than us having to do the same thing, it's not a very conducive system that they have right now. It's not something that I can see a lot of people being willing to do, honestly.
Well, Central Health says it is continuously reviewing its testing approach, but right now there are only 2 testing sites in its area, in Grand Falls, Windsor, and in Gander. The health authority says in certain situations it has made alternative arrangements for patients who need it.
A major union in this province is calling on the provincial government to cancel a deal with an American company, a deal that pays the company to find places to cut healthcare spending. CBC News has gained access to a contract that the province's 4 health authorities have signed with a U.S.-based healthcare company. Chris O'Neill-Yates has been on this story and she joins me now. So Chris, what can you tell us about the concerns over this contract?
So the company is called Change Healthcare, and they've been contracted to provide a computer algorithm, basically a program that will help all the health authorities in the province cut things like staffing, overtime, sick leave. And it's designed to integrate a bunch of systems within the healthcare authorities, and they will get paid a percentage of the amount of money that they find, or the amount of savings that they find. So they got $3 million up front when they signed this deal back last June, and they'll get up to $35 million over a period of 5 years based on the savings that they find within the healthcare system. This is going to start as a pilot project with Eastern Health at the Health Sciences Centre, and then it will radiate out to the healthcare authorities and the hospitals and acute care units all throughout the province. Now, CUPE has a problem with this. They say and they fear that it's going to lead to cuts, more burnout, and that they have staff that are already overworked within the system, and they don't like it. I spoke with the president of CUPE for Newfoundland and Labrador, Sherry Hillier, and she says that this contract must be stopped.
Well, why don't they just hire someone that's local, number one, that can actually go in and look at our systems and look at our work schedules. And number two, to save money in healthcare, what the government actually need to do is add more courses to train more registered nurses, more licensed practical nurses, and more personal care attendants. And that would help us with the overtime and the sick leave that's happening in our healthcare system. So also, if we have more staff in the system, would actually probably reduce the costs in healthcare.
So Chris, you've been speaking with the health minister today. What's John Haggie saying about this?
John Haggie says that the system is designed for exactly the opposite. He said it's meant to save workers, to cut down on burnout, to cut down on the amount of forced overtime that they're meant to work, and to match the needs of the healthcare workers with the needs of the patients, and to do so at a reduced cost. He called it moving healthcare management into the 20th or the 21st century. Here's John Haggie. I spoke with him earlier.
All scheduling on healthcare in the front lines is done on paper. And this was a way of getting that all sorted out so that it was electronic and you could match the staffing in a 2-week period to the expected demand on that unit. So you had the right staff mix, you had the right number of staff in place to manage the right number of patients that they had at the time.
So that's what the health minister's saying. What about the Progressive Conservatives? What's their reaction to this contract?
Well, the opposition doesn't like this one bit. They are along the same lines of what CUPE has been saying. Why are we going outside to a company that's based in the U.S., although they do have a presence in Canada? Why are we going outside of the province even to find a company that can do this? John Haggie says they have to because that kind of specialty doesn't exist here. But I spoke with David Brazel today, the health critic, and he's been looking at the contract too, and he doesn't like what he sees.
When I look at the contract, and the contract still reads that this company is going to be paid based on the principle of the money saved and the recommendations that are implemented around cuts, then I would think this becomes a profit-oriented exercise, and that worries me very much so.
So that's Progressive Conservative David Brazel. So, Peter, lots of discussion about this today.
Thank you very much, Chris.
You're welcome.
Well, the shortlist is out for this year's East Coast Music Awards. Newfoundlanders and Labradorians are up for 35 awards in total. Just have a look.
Put on movement on hold till my pockets were full.
Coming in with 3 nominations, Rube and Rake. They're nominated for Folk Recording, Group Recording, and Rising Star Recording of the Year for their album leaving with nothing.
Musician Bridges also has 3 nods. Singer and producer John Pike is up for Pop Recording, Dance Recording, and Fans' Choice Video of the Year for the song Dancing Without Music.
Also up for Pop Recording and Fans' Choice Video of the Year, solo artist Kim Harris. The Heavy Horses net nominations for Country Artist and Video Director of the Year. And Duo Concertante is competing for Classical Recording and Artist Innovator of the Year.
And there's more from the classical genre. Steve Cowan and Adam Ciccoliti are up for Classical Recording of the Year.
For Classical Composition of the Year, Andrew Stanland gets a nod. So does Becca Sims for her piece, Grenetic.
And the girls walk by with their backs up.
Switching genres here, Sherman Downey is up for Folk Recording of the Year for his album, New Beautiful.
While Matthew Byrne and his concert with Lady Cove Choir and Rum Ragged and its album, The Thing About Fish, are both in the running for Roots Traditional Recording of the Year.
Each one with a story all its own.
The group Silver Wolf Band from Happy Valley Goose Bay is nominated for Indigenous Artist of the Year.
And Natasha Blackwood, a member of Eastern Owl, is nominated for Inspirational Recording of the Year for her solo album, Ease Back. Justin Fancy is also nominated for Inspirational Recording with Sure Beats a Good Time. And we have Winter Hearth is in the running for Loud Recording of the Year. And we can't forget Swinging Bells. They're on Children's Entertainer of the Year shortlist.
And finally, Kelly Loader is in the running for Fans' Choice Video of the Year for this song, Molded Like a Monster. Congratulations to everyone who's nominated. We'll be right back.
This weather update is brought to you by the Healthcare Foundation Home Lottery. Order tickets now at hcfhomelottery.ca.
Well, Ashley, before you launch into the weather, we have a video to share with folks at home. It seems to be a new backyard trend, lockdown luge.
Yeah, this is how Aaron Parsons is spending his time in St. John's. Take a look at that.
That looks pretty fun. Yeah, that's a great job, actually, putting that together. I wonder how long it took them to build that. And up next, we have 6-year-old Penelope Brothers. Yeah, her dad helped build this luge. Penelope also wants to use this moment to say hi to her friends in Mrs. Ivany's kindergarten class and her cousins Zoe and Jake. Oh, just look at that face. Her mom says she's a huge fan of drizzle, Ashley. Your some hand at the weather. And of course, there is drizzle right on cue.
There is drizzle. Yeah, I figured she'd make another appearance. I gotta treat my hands. The only way to keep a puppy quiet. But thank you very much, Penelope. Drizzle says hi. Oh, but she sure loved the weather earlier today. She went outside, played in the snow, and then came right back in because it was a little bit windy earlier today, obviously. But temperatures were really awesome to get out and enjoy the snow this afternoon. Take a look at those highs, 1 degree. Once that sunshine came out, it was a beautiful afternoon to clear all of that snow that had just fallen. And then those temperatures across the board into the minus single digits, -2 in Makkovik and -7 in Lab City. But cold front pushed through and those temperatures dropped quite significantly for portions of the western portion of the island anyway, back down to -9 for Port aux Basques and then -17 for Lab City, still currently sitting around -1 for St. John's. There's a look at that cold front. This occluded front is what we call this purple one. That is what brought all of that snow earlier today, and if I zoom in a little bit, you can see another area of light snow is developing and about to move over the metro area as we head through the next couple of hours, and that's really the story as we head through the overnight tonight. If you take a look at the future tracker, I've added this winds in there for you as well, because they're going to ramp back up again for the southwestern portion of the island. As we head through the evening hours, we'll see a little bit of a lull in the winds for the rest of the province, and then as we head into the early morning hours, again, those winds are going to ramp up towards the Burin Peninsula. But you can see that break in the snow again. The northern peninsula, you'll see a break, and then that snow is going to head right back in as we head into the early morning hours. So anticipating that these winter storm warnings for the northern peninsula as well as southeastern Labrador will end, but the snowfall warning and blowing snow advisories will likely continue into tomorrow for most of Labrador. There's your drop in temperatures, -14 for Corner Brook tonight. Now, Port aux Basques, you're sitting at the lowest you'll probably sit at. The temperatures are actually going to bump up as we head through the night tonight. Otherwise, temperatures dipping quite significantly for the rest of the province. So if you haven't cleared that snow yet, you might want to do that as we head through the evening hours. And then temperatures hovering around the 0 degree mark. We're seeing a little bit of a warm up. So coastal areas for Labrador, you could see some showers mix in. And then winds are going to stay breezy again. Northerlies 60 to 80 kilometers per hour for northern portions of Labrador. Into tomorrow, as those winds ramp up again into the afternoon, what we're basically going to see is sun and cloud and then periods of snow move through. So round 3 will move through eastern areas as we head to the first half of the day. We should see a little bit of clearing, but a good snow squall setup looks like it will happen tomorrow, certainly for southwestern portions as well as the Burin Peninsula and southern Avalon as we head into the afternoon and evening hours, certainly for the west coast. As you head through the afternoon, you're going to see those winds ramp right back up again. So here's where our temperatures should be sitting, anywhere from -2 to -3. Some sunshine in play, but again, also those periods of snow, keeping things pretty windy for the southern portion of the island. And as far as that snowfall goes, will take us through to Wednesday morning. We're looking at about trace, maybe 2 to 5 centimeters, I'd say, and then even more so as we head into Thursday morning. And then snowfall amounts for Labrador, you're looking at about 20 to 40 centimeters by the time Thursday morning rolls around. So that's a look at tomorrow's forecast. We'll look ahead coming up.
Provincial wildlife officials say caribou are being hunted illegally in southern Labrador. They say around 30 hunters from Quebec have been killing animals. It's home to endangered caribou with only about 1,700 animals left from the Mealy Mountain herd. This hunt is a concern for Hollis Yetman. He's vice president of the Labrador Hunting and Fishing Association and a former conservation officer. Thanks for joining us.
You're welcome, Peter.
So what was your reaction when you heard that caribou were being killed in this area?
Obviously one of disappointment. We go through this seemingly annually, and yeah, very disappointing to hear once again.
So we've heard that wildlife enforcement officials are essentially taking a fairly hands-off. They're gathering evidence, they're kind of keeping an eye on the situation, but they're not actually going in and arresting people. What do you think they need to do in order to enforce this ban on hunting?
Well, to be honest, Peter, I think when we're in the country and the remote locations are not accessible by road, it's only snowmobile access or aircraft. It's already too late to do any amount of enforcement. As you can appreciate, you mentioned 30 hunters in the country on snowmobile, going around with guns. It's a very difficult logistical enforcement problem to deal with. So it's already too late. What we need to be doing, and it happens annually, and the onus is on provincial authorities, federal authorities, Indigenous leaders within Newfoundland and Labrador to step up before spring every year and start talking about this situation and negotiating and get involved. It's once the snowmobiles leave town, it's already too late to do enforcement. It's a dangerous situation to get in there on the ground with multiple hunters, snowmobiles, guns, helicopters, and so on, if you understand what I'm saying.
What do you think would be lost if all the caribou were wiped out from the Mealy Mountain herd?
To put it in perspective, you said that the estimated population was 1,700 plus or minus, I guess, and that's over an 80,000 square kilometer area. They don't mix and mingle with the other caribou that are in other parts of that 80,000 kilometer range. So when they're gone, when they're hunted, dead, they're gone. There's no other caribou walking into that territory. So it's very disappointing. It's the closest bunch of caribou to the Labrador southeast coast, and they're very vulnerable. They can't sustain any type of hunting activity whatsoever.
You touched on this a little bit briefly, but how do we kind of end this cycle? Because this isn't the first time that we've seen hunting in the area. Every year it seems to be kind of the same process where they take some evidence, they can't lay any charges, and then next year it's the same situation again.
You have so many jurisdictions. You have provincial and federal jurisdictions from 2 different provinces. You have Indigenous rights involved. And they all seem powerless to be able to stop what's happening here, and it's very, very frustrating to people of Newfoundland and Labrador and to everybody. Even residents of Quebec that I've spoken with, they don't support what's happening here. They want to see caribou populations grow. Most of the caribou, and in fact, if not all, south of the 52nd parallel, which is the Quebec-Labrador border, are non-existent. They're gone, and they're gone because they've been hunted back that far, and snowmobilers keep traveling back farther and farther to get the remnants of what's left and what's trying to grow annually. You got to sit at the table. You got to get to the table and get to the crux of this. I mean, if caribou are dying because there's some other land agenda, then get to the table and start discussing it.
Well, Hollis Yetman, I appreciate you sharing your perspective today. Thanks.
Thank you, Peter.
Our members don't really know what the plan is for some things that could be happening. We worry about, a sudden influx of hospital inpatients.
The union representing respiratory therapists meets with a government and caretaker mode to discuss concerns about staffing capacity. That's coming up next. The union that represents respiratory therapists in the province has been raising concerns about staffing capacity if we see another spike in COVID hospitalizations. There are around 60 respiratory therapists in the province who operate ventilators that supply oxygen to critically ill patients. Well, yesterday, the union met with Liberal leader Andrew Furey and Health Minister John Haggie to discuss those concerns. And joining me now is Union Representative Gordon Piercy. So, Mr. Piercy, what came out of that meeting yesterday?
Well, we did meet late yesterday, and we discussed some of the concerns that we had. For my end of it, we had two sets of concerns: more of the short term, and then more of the long term concerns with the workforce.
And what are those concerns?
Well, immediately, the short-term pieces are just, we agreed that we would look at trying to make better communication, facilitate that a little bit better. Our members don't really know what the plan is for some things that could be happening. We worry about, a sudden influx of hospital inpatients, which would have a demand on the respiratory therapy workforce. We also are worried about what would happen if a group of these therapists, through a set of circumstances, would have to isolate or will no longer be available to work because of a potential exposure or requiring of self-isolation.
So government is in caretaker mode right now because of this prolonged election. What kind of a response did you get from them?
Well, as far as our short-term stuff, I am pleased to say that Minister Haggie said he would certainly take a role in trying to create some improved communication. And I guess, Carolyn, what I'll say to you there is that I'm not going to say that the communication between AAHP and Eastern Health is bad. I think it's the full circle. It's how the three, us, government, and the health authority are kind of communicating right now. That's the short-term stuff. The long-term stuff is around workforce issues, workload, staff availability at different units, and recruitment and retention, which right now for this group is huge.
So, it feels like the new COVID case numbers seem relatively under control. We've been mostly seeing single digits every day of new cases, but we all know how quickly the situation can deteriorate, especially with the variant now among us. What's your biggest fear for respiratory therapists right now?
Well, one thing we know about this pandemic is that the more we know about this pandemic, the more we don't know about this pandemic, and it sort of catches us periodically, with our guard down. So I am worried about that group. I am worried about them being able to meet the need. And Carolyn, I certainly don't want to stoke public fear. That's not what I'm here for today. And I want to reassure the public that our members are on the ground and they're doing stuff, not just our respiratory therapists, right across the 25 occupations that we represent. They're a good crowd. They're a hard-working bunch. So our message to government is, and I guess I'm saying this, Carolyn, to whoever is the new government, we'll be talking to you right away. We're going to come in, and I certainly shared that with Liberal leader Andrew Furey and with Minister Haggie, that we want to have conversations very soon after this new government, whoever that may be, is. So when they're minted, we want to have those conversations to look at the recruitment and retention, to look at the workload assignments, and how we can make this easier.
Okay, Gordon Piercy, I'm sure we'll be checking in with you again on this. Thank you so much.
Thank you very much, Carolyn.
Canada is hours away from getting its first batch of the Oxford AstraZeneca vaccine. Health Canada has deemed it safe for all adults, but an independent panel of experts says the vaccine should not be used for seniors yet. And there is growing real-world evidence that could change that. David Cochran reports.
The first doses of the AstraZeneca vaccine will arrive on Wednesday from India, bringing new supply and new uncertainty.
The conflicting advice between Health Canada and experts on the immunization task force is concerning.
There's no disagreement as to whether the vaccine is safe, but there are questions as to whether it is the most effective choice for people over 65. So the immunization task force recommends for now it be used solely on younger people.
It has been shown to be effective for people under 65. That's been shown by several of European studies that have been done because the AstraZeneca vaccine has been used quite extensively there.
Don't read their recommendations as sort of static. They will update as needed.
Canada's chief medical officer says there's growing data the vaccine is effective for people 65 and older. The United Kingdom is using it widely. France has approved it for people up to 75. Dr. Tam suggests Canada's guidance could eventually change, but for now, the early doses could be given to young people.
There's an opportunity, essentially, for a group of people who wouldn't have got the vaccine till, a couple of months later to have the opportunity to get it.
Canada is set to receive more than 20 million AstraZeneca doses, most of them in the spring and summer. By then, even more data will be available, allowing for greater clarity as to whether it's a good option for people over 65. David Cochran, CBC News, Ottawa.
Well, to Montreal now, where a teen who isn't playing hockey because of the pandemic is looking forward to getting back on the ice. And when he does, he's hoping to see changes. As a Black player, he says he's faced racist taunts and slurs. The teen has found a safe place to talk with other players of color, and now he's working on widening that support. Kwabena Odero reports.
When Mateo Prairie Short first stepped on the ice, he fell in love with the game instantly. But that love hasn't always been returned.
I knew I was different the second I stepped on the ice.
The thrill of scoring goals and winning championships hooked Mateo at the age of 8. But he says there's a dark side to playing competitive hockey for BIPOC players.
We were in the semifinals, and I scored the tying goal, and I go to celebrate in the stands, to celebrate, yeah. And there was a family flipping me off and calling me the N-word.
Mateo says coaching isn't immune either.
Coaches would look at me differently, maybe less ice time. And
you have gotten less ice time because...
Yeah, I felt it, the ignorance from the coaches.
His mother, Moshella Short, had no idea any of this was happening. Then over the summer, Mateo finally opened up.
I felt powerless.
She didn't know where to turn.
There are not a lot of other parents in the stands that look like me, so who am I going to go say this to and ask for advice on how I should deal with it?
Short says this was a game changer. She came across Skating for Diversity online. The U.S. organization connects BIPOC hockey players like Mateo to share their experiences.
We really want to create a safe space and a network for players of color to connect with.
Mateo and his mother want to provide the same support for BIPOC players here in Quebec. They are starting their own diversity group for parents, players, and coaches alike.
I would love to see coaches seeking out information on how they can support their Black players, how they can learn to identify when racism is taking place, and what to do about it.
Mateo, you want to tell me a little bit how you're doing, man? I was asking you before, but I know we were talking about school.
When Chase Harwell heard about their plans, he wanted in. The assistant captain for the Concordia Stingers grew up playing in the junior league with the same kind of slurs.
I just didn't blow it up, which I think now, the me now at 24 blew up, blew that up. You know what I mean? Because that's not all right. You know what I'm saying? And I'm not having that.
Mateo and his mother hope other players like Harwell will join them. They hope to have their first online session ready when the puck drops on a new hockey season in September. Kwabena Odero, CBC News, Montreal.
Books by the children's author Dr. Seuss have been popular for decades, but 6 of them aren't going to be published anymore. That's because some of their imagery has been deemed racist and insensitive. The company that oversees the estate says the books portray some characters in ways that are, quote, hurtful and wrong. The list of Dr. Seuss books no longer for sale include And to Think That I Saw It on Mulberry Street and If I Ran the Zoo, along with 4 others. The books have been criticized for the way Black, Asian, and other characters are drawn and portrayed. The decision to stop publishing them came after feedback from readers, including teachers.
Ashley is back with a look at the long range. And Ashley, it was so nice to see the sun come out this afternoon after all that snowfall earlier today. What's the situation with the snow? Are we going to get a break for a little bit from the snow?
Well, I guess we're going to get breaks at times, but we are certainly not done with the snow as we head through most of the week, really. It's thanks to an area of low pressure that's going to essentially stall over the province as we head into Thursday, even into Friday. Let's take a look at that. This is us Thursday morning. You can see that area of low pressure just south of Labrador at this point, and you can, as we head through the afternoon, the winds are really going to ramp up along coastal areas of Labrador, at least through the first half of, or rather, the west coast of the island as we head through the first half of the day on Thursday, and then we're going to see some snow continue. Some rounds of snow, eventually a little bit of a break Thursday afternoon for eastern areas of the island, and then into Friday morning, that snow is generally going to be the story for Labrador as well as the west coast of the island. So unfortunately not going to see a break there. We'll see likely stay cloudy for across the board. Maybe the northern peninsula will see a few peaks of sun, but overall this is what we're looking at. Temperatures into the minus single digits, a little bit warmer for the east, about 1 degree for St. John's, and then we've got temperatures into the minus single digits up through Labrador as well as Lab City at -8. And then into Friday, sunshine starts to become a little bit more dominant. We'll see pretty much from the eastern areas towards central, even the northern peninsula. Looks like you're done with the rain, or rather with the snow for a little while. And then Corner Brook will be sitting around -3 and -6 for Port aux Basques, and then back down to those minus single digits, or should I say up to those minus single digits for Lab City at -7. Looks like through Friday, even into Saturday, we're going to see temperatures near or above zero. Things will start to get a little bit, or will stay unsettled, but again, more sunshine in play on Saturday, maybe a few peaks of sun. And then for Sunday, back to those cloudy periods and the potential for a few flurries. And then as far as central Newfoundland goes, Sunday looks like we'll see the sunshine, but Saturday looks a little bit gray. Temperatures back down to those minus double digits overnight, but flirting with or just below the 0 degree mark as we head into the weekend. And then for western Newfoundland, gray skies and flurries, the story essentially through Sunday. Temperatures ranging from -2 to -3, and then overnight lows really not moving much. You may lose a degree or two. And then for eastern Labrador, Friday looks like some sunshine and then back to those gray skies, but temperatures into the minus single digits. And then same thing for western Labrador, but unfortunately that will be gray skies and flurries through the day. So I wanted to share this photo. I thought this was a great one. This is Rocky Bear Cove in Leading Tickles. Roger shared that lovely shot of the angry sea with us. Thank you so much for sharing that. And if you have any weather photos to share with us, send them to nlphotos@cbc.ca.
What a great photo. Thanks so much, Ashley. And before we finish up tonight, Peter, we have some stunning video to share from the Northern Peninsula. It shows a crew who don't seem to mind all the snow whatsoever.
No, not at all. This was captured by photographer and videographer Tom Cochran. Have a look.
Beautiful. These caribou trudging through some pretty deep snow there. They were recorded near St. Anthony Airport.
Yeah, incredible to see them up close like this. What a beautiful, and just the lighting, oh, wonderful.
Yeah, I like the music too. Thank you, Tom Cochran, for this wonderful video. So nice.
So important to find those little moments of beauty where you can.
Absolutely, it's so true. And Peter, tomorrow is Wednesday, so we have the briefing coming up tomorrow, which you will no doubt be covering. Is there anything that you're going to be looking for tomorrow? Anything that you're going to be asking?
Oh, always have lots of questions, Carolyn.
You do?
One of the things I'd like to get more clarity on is, we're seeing a couple of cases a day. It's still a lot lower than it was, but right now we don't really know where these cases are coming from. So I'm hoping that they can give us some, are these contacts of existing cases? Is this still community spread? These are some of the questions that are going to be really important as we start to evaluate, is it going to be safer to go out of alert level 5 at the end of next week?
All right, great. We'll all be listening. Thanks, Peter.
And thank you. Have a great night, everyone.
Good night.